This is a cover-to-cover review in Abnormal Psychology. Part 1. Psychological disorder. Psychological dysfunction within an individual associated with distress or impairment functioning and response that is not atypically or culturally expected. Example: the blood injection injury phobia. Judy fainted when she unavoidably encountered something bloody. She fainted 5 to 10 times a week, often in class. Her family physician could find nothing wrong with her, nor could several other physicians. For people who react as severely as Judy, this phobia can be disabling. They may avoid certain careers, such as medicine or nursing, and, if they are so afraid of needles and injections that they avoid them even when they need them, they put their health at risk. Psychological dysfunction refers to a breakdown in cognitive, emotional, or behavioral functioning. The greater the deviation, the more abnormal it is. In most cases, the more productive you are in the eyes of the society, the more eccentricities society will tolerate. Therefore, deviating from the average doesn't work well as a definition for problematic abnormal behavior. Robert Sapolsky, 2002, the prominent neuroscientist who, during his studies, worked closely with the Maasai people in East Africa. Jerome Wakefield, 1999, 2009. Harmful dysfunction. A related concept that is also useful to determine whether the behavior is out of the individual's control, something doesn't want to do. Phobia. A psychological disorder characterized by marked and persistent fear of an object or situation. Diagnostic and Statistical Manual of Mental Disorders describes behavioral, psychological, or biological dysfunctions that are unexpected within their cultural context and associated with present distress and impairment. Prototype in DSM-5. This means that the patient may have only some features or symptoms of the disorder, a minimum number, and still meet criteria for the disorder. Psychopathology is the scientific study of psychological disorders. Within this field are specially trained professionals, including clinical counseling, psychologists, psychiatrists, psychiatric nurses, as well as marriage and family therapists and mental health counselors. Let's discover the following field of psychopathology. Clinical psychologist and counseling psychologist receive the Ph.D. Doctor of Philosophy, or sometimes an Ed.D. Doctor of Education or Psy.D. Doctor of Psychology, and follow a course of graduate-level study lasting approximately 5 years, which prepares them to conduct research into the causes and treatment of psychological disorders and to diagnose, assess, and treat these disorders. However, counseling psychologists tend to study and treat adjustment and vocational issues encountered by relatively healthy individuals. Clinical psychologists usually concentrate on more severe psychological disorders. Also, programs in professional schools of psychology, where the degree is often a Psy.D., focus on clinical training and to emphasize or eliminate research training. In contrast, Ph.D. programs as universities integrate clinical and research training, such as experimental and social psychologists, concentrate on investigating the basic determinants of behavior but do not assess or treat psychological disorders. Psychiatrists first earn an MD degree in medical school and then specialize in psychiatry during residency training that lasts 3 to 4 years. Psychiatrists also investigate the nature and causes of psychological disorders, often from a biological point of view, make diagnoses, and offer treatments, although most use psychosocial treatments as well. Psychiatric social workers typically earn a master's degree in social work as they develop expertise in collecting information relevant to the social and family situation of the individual with a psychological disorder. Social workers also treat disorders, often concentrating on family problems associated with them. Psychiatric nurses have advanced degree, such as a master's degree or even a Ph.D., and specialize in the care and treatment of patients with psychological disorder, usually in hospitals as part of a treatment team. Finally, marriage and family therapists and mental health counselors typically spend 1 to 2 years earning a master's degree and are employed to provide clinical services by hospitals or clinics, usually under the supervision of a doctoral-level clinician. However, scientist practitioners, mental health professionals who take a scientific approach to their clinical work. Mental health practitioners may function as a scientist practitioners. Clinical description. When we said clinical description, it represents the unique combination of behavior, thoughts, and feelings that make up a specific disorder. Clinical refers both the types of problems or disorder that you would find in a clinic or hospital and to the activities connected with assessment and treatment. In a hospital or clinics, we often say that a patient presents with a specific problem or set of problems, or we discuss the presenting problem. Presents is a traditional shorthand way of indicating why the person came to the clinic. Prevalence of the disorder refers to the statistics on how many new cases occur during a given period, such as a year represent the incidence of the disorder. Sex ratio, that is, what percentage of males and females have the disorder, and the typical age of onset, which often differs from one disorder to another. In addition to having different symptoms, age of onset, and possibly a different sex ratio and prevalence, most disorders follow a somewhat individual pattern, or course. Chronic course, meaning that they tend to last a long time, sometimes a lifetime. Episodic course, meaning individual is likely to recover within a few months only to suffer a recurrence of the disorder at a later time. Acute onset, it means that they begin suddenly. Others develop gradually over an extended period, which is sometimes called an insidious onset. For example, if someone is suffering from a mild disorder with acute onset that we know that is time-limited, we might advise the individual not to bother with expensive treatment because the problem will be over soon enough. Like a common cold. Prognosis refers to the anticipated course of the disorder. Prognosis is good, meaning the individual will probably recover. Prognosis is guarded. It means the probable outcome doesn't look good. Developmental psychology. This is the study of changes in behavior over time. Developmental psychopathology refers to the study of changes in abnormal behavior. Lifespan developmental psychopathology, the study of abnormal behavior across the entire age span. Let's proceed to the causation, treatment and etiology outcomes. Etiology, or the study of origins, has to do with why a disorder begins, what causes it, and includes biological, psychological and social dimensions. Psychopathology is rarely simple. This is because the effect does not necessarily imply the cause. Historical conceptions of abnormal behavior. There are different types of treatment approach. Number 1. Psychodynamic approach. Number 2. Cognitive behavioral approach. Number 3. Humanistic approach. Number 4. Psychosocial treatment. This treatment refers to the non-medical treatments that focus on psychological, social and cultural factors. Theories or model of behavior. The purpose of this models is to explain why someone is acting like that. 3 major models that have guided us date back to the beginning of civilization. Humans have always supposed that agents outside our bodies and environment influence our behavior, thinking and emotions or biological model. 2. The agents, which might be divinities, demons, spirits, or other phenomena such as magnetic fields or moon or stars, are driving forces behind the supernatural model. 3. The mind has often been called the soul or the psyche and considered separate from the body. Although many have thought that the mind can influence the body, in return, the body can influence the mind or psychological model. This split gave rise to two traditions of thoughts about abnormal behavior, summarized as biological model and the psychological model. Now, let's check what you have learned. For Part A, please answer according to the following definition of abnormality in the blanks. Here's the choices. A. Societal norm violation. B. Impairment in functioning. C. Dysfunction. D. Distress. I will give you 10 seconds to think for each number. Number 1. Miguel recently began feeling sad and lonely. Although still able to function at work and fulfill other responsibilities, he finds himself feeling down much of the time and he worries about what is happening to him. Which of the definitions of abnormality apply to Miguel's situation? Number 2. 3 weeks ago, Jane, a 35-year-old business executive, stopped showering, refused to leave her apartment, and started watching television talk shows. Threats of being fired have failed to bring Jane back to reality, and she continues to spend her days staring blankly at the television screen. Which of the definitions seems to describe Jane's behavior? Now, let's proceed on Part B. Here's your choice. A. Presenting problem. B. Prevalence. C. Incidence. D. Prognosis. E. Course. And F. Etiology. Number 3. Maria should recover quickly with no intervention necessary. Without treatment, John will deteriorate rapidly. Number 4. 3 cases of bulimia have been reported in this country during the past month and only 1 in the next country. Number 5. Elizabeth visited the campus mental health center because of her increasing feelings of guilt and anxiety. Number 6. Biological, psychological, and social influences all contribute to a variety of disorders. Number 7. The pattern a disorder follows can be chronic, time-limited, or episodic. Here's the last question. Number 8. How many people in the population as a whole suffer from obsessive-compulsive disorder? The answer for Part A, number 1. Letter D, number 2. B or C. For Part B, number 3. D. 4. C. 5. A. 6. F. 7. E. And number 8. Letter B. Please hit the subscribe button for more updates. Thank you and God bless.